Hey, welcome to Resurrecting Our Freedom. This is my good friend, Dr. Fred DiDomenico, handsome young Italian man.
Thank you.
I love him so much. I am Dr. Douglas DeSiena. And with me today is a specialist in pharmaceuticals. He graduated from USC. He has a doctorate degree in pharmacy. And we've been talking a long, long time about the development of this COVID and where it's headed and kind of the debacle that's unfolding as a result of it. So with me today is Dr. Amir. Dr. Amir, welcome to Resurrecting Our Freedom.
Thank you. Thanks for having me.
Hey, so we want to go through a couple things. First of all, I just want to know what your perspective on the COVID is, where it started, and kind of what woke you up to the idea that we are taking this COVID virus way too far in terms of the lockdowns and some of the very draconian things that we're doing for people. And so can you just give us a little bit about your background and why and how you got woke to this whole situation?
Yeah, sure. My background, you briefly mentioned, I went to USC Pharmacy School. I did a couple of years of specialty residencies and went into teaching at USC for a few years, as well as working at the acute care hospital out there. After that, I went straight into long-term care consulting, where I see patients in what are commonly called nursing homes every month and evaluating their drug therapies. Been doing it since 1998, so it's been a while. And I've seen a lot of different things in the healthcare industry. As far as COVID, I remember hearing about it in December, a virus out in China, a respiratory virus out in China. And right around January, beginning of January, one of your patients, one of my good friends, I'll leave his name out of it. He asked me, he's not very well, he's not very good as far as healthcare is concerned. So he comes to me with this stuff. So he asked me, what do I know about it? And I did a quick search about some of the data coming out of China. And what it looked like to me at the time in January was another type of respiratory virus that kind of like influenza hits the elderly very hard. The numbers were very low, preliminary back then, but the distribution of the types of deaths and the age groups looked a lot like the influenza.
Yeah, so I remember back then, it wasn't that long ago, right? Where they're saying this killer virus is coming. It was like the impending doom, and it's like the cloud of locusts. They're coming over to eat everything and infect people. And it was like, something seems fishy about this. Yet they were trying to perpetuate that fear. So, hey, you're an expert in this, right? And you just saw, it doesn't really look any different than what we go through every year. But let's see what happens.
Yeah, essentially, part of that fear, there's multiple reasons. We've talked about it, whether it be politically based or just popular culture, all these movies where you see the killer viruses coming around, right? Our experiences in the past with MERS and SARS and H1N1, swine flu, right? So it just kind of prepped the national, I don't know even how to say it, the way we think about these things differently. So when this thing came out, and history will show how and why it got blown up so quickly, so fast in terms of the media and how it was portrayed. It was surprising, yet not surprising to see how it got blown up so quickly.
Well, let's not forget, Amir, let's not forget that everybody was following a faulty model. That was Dr. Neil Ferguson out of England, who predicted
1.2 million or something we're going to die.
A death rate was multiple times higher than the actual death rate that we have. So it's like we followed a model. And by the way, just for the record, Neil Ferguson has a dubious past in his previous predictions. And why in the world did we follow him again down this dubious kind of prediction that he had?
Well, and not only that, let me interrupt everybody. It was shortly after he came up with that model that he personally determined it was an inaccurate model and we couldn't use it.
Right.
But the U.S. government kept using that model.
And also a lot of other scientists, to interrupt all of this, a lot of other scientists try to remake that model with the data, and it never came up. They could not come up with the same outcome. But anyway.
So you were seeing all this too, so... Sorry, go on.
No, I was seeing it too. And this was, those modelings started to come out, about February sometime, middle of February. And as part of my master's program, I actually took a class on modeling, and it showed us, I mean, there's multiple different kind of models, but the old adage of garbage in equals garbage out, a lot of these models, some of the variables you put in, if you change it by 1 or 2%, the outcome on the models can vary by 50 or 100%, right? So whatever variables they were using to put this model together that came out with the 2 million estimated deaths, it could have been something as simple as the infection rate, or the R naught is what they call it, right? You change that by a few percentages or a few degrees, you're going to get a massive change in your outcomes. So putting a model together with limited data in the very beginning, sure, might have been nice to see what it would look like, but to report it as this is what's going to happen, looking back for them, probably not the wisest move.
Well, now I'm sorry, but for all our listeners, the R naught number, doesn't the R naught number relate to the virulence, like how strong it is?
It relates to
infection rate?
it relates to how easily it transmits to other people.
Okay.
The virulence is something a little bit different, but R naught basically is if the flu, for example, for every person that catches the flu, they spread it to 1.1 other people, for example, right? The higher the R naught, the worse. Measles, I believe it's like something like 16 or something like that. For every person that has measles, they spread it to 16 others. The higher the R naught, the worse it is. So if you plug in a certain kind of R naught into your modeling, you're going to come out with these massive numbers, especially the mortality rates at the time, which were thought to be 7 to 10%. You know, a 10% mortality, a high R naught, and you're going to have something like 1 billion infected and 30 million deaths. You know, these are the kind of numbers you work with in early modeling that should probably come with a caveat if we don't have all the complete data yet.
How soon, I'm just curious, how soon into the modeling did many scientists believe that Neil Ferguson's model was way off? When did that come out?
I thought it was relatively quick afterwards. From what I recall, the news was coming out, you know, everyone was reporting the 2 million deaths, and our nation's healthcare decision makers were basing their decisions on that. But I believe very quickly afterwards, they didn't, there was, I don't want to call it dissent, but disagreement in terms of what the total numbers were going to actually be. That was early. Now, I don't know if you guys have looked, but if you look at some of the more recent modeling where they've put in some more data, and some of the more recent modeling looks a little more accurate in terms of, you know, they said by November, you're going to have 240,000 deaths in the US, for example, right? And it looks like right now, for example, by November, we're going to have about 240,000 deaths. So the more accurate numbers you can put into this modeling, the better outcome, the better data you're going to get out, or the better outcomes you're going to get out.
Just so we're clear, so two things on that. Number one, what about that 85% of those numbers that you just talked about were actually as a result of comorbidities versus actual causes?
No, it was 94%.
94% rather, 6%.
Right. So that was that CDC. CDC put it on their website, I believe, about a month ago. Along the lines of only 6% of the deaths from COVID, they only had COVID. 94% of the other deaths, they had other comorbidities. And we've talked about this. So, and depending on which side of the line you're on, you took those numbers differently. But basically, you can think of it this way. The CDC kind of put it out incorrectly as far as they didn't describe it well enough. They're basically trying to say 6 out of 100 people that catch COVID only had COVID and died from COVID. The other 94 had something else. We don't know if it attributed to their deaths, but they had something else. But by something else, they included, it was like a blanket comorbidity statement. Could have been rheumatoid arthritis. Could have been, you know, you guys see all these long-term diseases all the time. How many people out of 100 have some kind of long-term disease, be it any kind, inflammatory?
Well, in this country, a lot. I'm just curious.
In this country, a lot. So, yeah, no, this country, it's obesity, morbid obesity, and all these kind of things. You see it a lot. So chances are very high that someone's also going to have the comorbid. I see it all the time. almost every one of my patients has some kind of comorbidity, right?
I'm wondering if those comorbidities qualify as a gunshot wound to the head and a car accident.
Yeah,
a
well,
run from
those you see the news about, like, if they died from a motorcycle accident, they had COVID, it was listed as part of
Right.
potential that, like we joke about that, and not joke in terms of how they died, but we talk about those numbers and we say, oh, this is ridiculous. We have to talk about those are very isolated cases on both ends. A lot of people on the other end will say, well, there's a lot of people that died that it wasn't counted. People died in their homes in the early days, and nobody knew that was COVID. Very true. But again, how many people are you talking an extra 5,000, 10,000 people that may have died and COVID wasn't captured on their cause of death? Okay, you can add those to the total morbidities, but what about the tens of millions that had COVID that weren't diagnosed with it and they survived? You got to add those to the survivals, right? So it goes both ways. You can talk about these exceptions, or you can talk about these relatively small numbers in terms of uncaptured COVID deaths, but you also have to talk about the larger uncaptured COVID cases. And as you guys are seeing, if you follow it every day, yes, there's more cases every day. Yes, there's deaths every day, but the overall mortality is dropping.
Right. So we're just testing herd immunity. Wouldn't that be it? I mean, people are exposed that aren't sick just because you test positive. Isn't that herd immunity?
Herd immunity, for this disease, they haven't decided on what the number is to achieve herd immunity. They haven't come out with anything yet, but for the flu, for example, it's something like 70%, right?
Yeah.
So, or the average disease, 70%. So what you're doing by getting all these cases out, or getting all this data with all the testing you're doing, is you're basically seeing exactly how many people have it. What are our state politicians like to call it, the positivity rates? Mm-hmm. What percent of patients come up positive from the testing, right? All of this is data you're gathering, right? Data. 50,000 cases today, 700 deaths today, right? That's not a 7% mortality, right? So mortality levels are dropping. The antibody testing that we talked about, that was done a few months back, where it showed, it looks like based on antibody testing, the actual case counts could be anywhere from 10 to 15 times higher than reported, right? Right now, we're at 8 million documented cases. According to the antibody testing, we should be at 80 to 120 million cases just in this country alone, right? 120 million cases, that's 33% of the country, right? Herd immunity, if you keep going at this pace, herd immunity can be achieved by this time next year. But you're going to have a lot of people saying, hold off on that. Don't say, the numbers aren't out. We don't know what herd immunity is yet. We don't know what the numbers are. But what we always talk about, Dr. G, the offices, and all this testing, all this data is coming out, and more and more it shows mortality rates dropping. And the CDC even came out and said CDC estimated mortality to be 0.2%, 0.26%, something like that.
Yeah.
Other people disagree, say it's slightly higher, but we always talked about it from the very beginning. We thought it would drop under 1% somewhere.
Right. So now the things you're doing now is you monitor the drugs that are given to the seniors in nursing homes, right? I mean, you're looking at their medication, their programs. So you're intimately involved with what's going on in the nursing homes. So can you talk about that, since that was really the majority of the deaths was from nursing homes? Can you give us what you've learned about that?
Yeah, so in the beginning, a lot of the cases and deaths were in these nursing homes. I go to about 12 to 15 accounts every month. And in the beginning, let's call the beginning when things started really going crazy, February, March, April, nursing homes, they were having massive outbreaks, whether it was their staff or their patients. Mortality rates obviously high. You're talking about generally elderly people with multiple comorbidities, or you're talking about nursing homes now. They're basically rehabilitation centers for a lot of ortho procedures, It used to be done in the hospital, but now they send them out to nursing homes, hip surgery, knee replacement, whatever it may be. They do rehab there. These people are also maybe not exactly 30 years old. They're on the older end spectrum, and they have comorbidities. So there was pretty big outbreaks, and we all saw it in the news, right? We saw it almost every day in the news. So and so nursing home, 80% of their patients caught it, or so and so nursing home, they had like 100 deaths in 3 weeks, whatever it may be. That was happening in the very early stages, and now, I mean, 1 case here, 0 case there. These nursing homes have really clamped down as far as their infection control. And it, based on what I've seen the past couple of months, their infection rates are much better than the community.
So is that even really a threat in nursing homes anymore?
It's a continuous threat in terms of it's out there and it can come into nursing homes pretty easily. But they've gotten so much better about monitoring their patients. Whenever they admit a patient, they sort of put them on part of the wing of the nursing home where they can monitor them for a week or so to make sure they don't develop any kind of symptoms. So it's kind of like a mini quarantine they put up. They have, when they have a case, they have specific rooms set aside just for COVID patients, and nurses set aside just to help treat those patients. It's not a threat in terms of the numbers inside the nursing homes, but it's a community threat that can always enter. They still have restricted family visits and all of that. That's part of the thing. They're keeping it out by restricting who comes in.
So what do you think about, we see Como and these other governors that have shoved all these COVID positive people in nursing homes that was actually illegal? What do you know about that? And based on just your experience, how do you feel about those policies?
It wasn't just Como, because remember what New York does, typically California does. I saw the all facilities letter from California to tell these nursing homes. It was almost a word for word thing, word for word letter that New York sent to the nursing homes, basically saying you're not allowed to not admit these patients. If the need arises and we need to send them to you, you have to take them. And based on what we knew about how the population in nursing homes and the staffing in nursing homes, in terms of, nursing, people get the misconception they're like hospitals where there's a one nurse for every 1 patient or something like that. It's not like that. It's 1 nurse for every 30 patients. The staffing is much different than what a hospital is. The monitoring is much different. The patient population, they're not equipped to deal with a highly infectious virus. So when I saw that letter, I immediately texted some of my nursing home friends and said, this is going to be a problem. And sure enough, it was.
So Amir, let's stop right there. I just want to land on that concept. So here's what we did. We took well people who were healthy, who might catch the virus and maybe get a sneeze or nothing at all, and we locked them down. At the same time, we have 2 of the most populous states, California and New York, and we're taking sick people who were infected with the virus, and we're putting them into the most vulnerable place you can possibly put them into, and allowing that infection to go through that population, which has a huge lethal morbidity and mortality rate. And so it was almost like if you tried to mess this thing up, like if you
did a really good job.
It was like they were intentional. At the same time, we took people, which I like to address, they took people who were well and they quarantined them, which, as we talked about, causing these people, this population, the healthy population, to get sick and to commit suicide and to have alcohol abuse and opiate addictions. So we basically drove an entire well population into sickness on both levels by completely mixing up the policy.
Yeah, I mean, something we always talked about. It's like, I don't know if you could have said it better. If you were trying to mess this up in the early stages, you couldn't have done a better job than what was done early. Whether it be panic-driven, fear-driven, lack of preparation from our county officials or our state and federal officials, whatever it may be, there's just certain common sense measures you would take. And just outside of coronavirus, influenza, the nursing homes take influenza very seriously. Like they really tried hard to immunize all their patients, their staff. Influenza they take seriously. So when you're talking about a virus that's more infectious than flu, and even though it's not as deadly as maybe it's made out to be, it's still deadlier than influenza. You're taking that virus and you're introducing it into places that shouldn't be considered primary care centers for.
Should be protected, if anything.
They should be protected, right? The elderly are the ones that should be protected. These are the populations that should be protected. And that was part of what some of these other experts have said from the beginning, even now. You protect the at-risk population. Those are the ones you care about, you pay more attention to, or maybe isolate a little bit more than you normally do, not the young and healthy.
So let's talk about the Great Barrington Report, which is pretty much what we're talking about right now. Also, just one brief correction. I think it's correct. You mentioned about the high mortality rate of the COVID. In actual fact, relative to the flu, but in the younger population, COVID actually has a lower fatality rate relative to the flu. Do you agree with that?
Yeah, if you look at the demographics, and again, a lot of this data is readily available for anyone online, whether it be the CDC website, WHO, wherever you want to get this information. The COVID, yes, it's more deadly for the elderly population, but it's not hitting kids as hard as the flu does. It's not hitting young adults as hard as the flu does. It's only when you start getting up in the age demographic is when it starts reversing and becoming more deadly. Overall, it looks, depending on the mortality per 100,000, if you normalize it per 100,000, depending on the data you're looking at, this virus is anywhere from 6 to 12 times as deadly as the flu. Overall, so far, the COVID mortality numbers, again, we keep dropping. Right now, it's about 6 to 15 times more deadly than the flu, being that the flu wasn't very deadly to begin with. So, I mean, put that where you think it belongs as far as coronavirus. But yeah, you're right that this age demographic is not as hard, not nearly as impacted as the older demographic when comparing the two viruses.
Nice.
Let's talk about let's go into the Barrington report.
The Barrington Initiative, I believe it's called. It's a group of healthcare industry experts, be it virologists or epidemiologists from around the world. It looks like I looked over some of the people that started this initiative. Pretty well diverse and a renowned group of people. Basically put out there that, hey, as bad as this virus may be, the main point is it's not bad enough where we need to do what we're doing right now in terms of shutdowns and locking everything down. They specifically brought up what we've been talking about from the very beginning, what you've been talking about from the very beginning. Some of these other unintended consequences have been popping up from the shutdowns, more suicide rates, child abuse, domestic abuse. And let's not even forget what's rarely talked about, the psychological impact on children this is having. The world is ending. This thing's going to kill you. If you catch this, you're going to kill grandma and grandpa. Stay home, stay away from this. Those of us that grew up during the Cold War era, I'm still old enough for that, remember the constant threat of nuclear war at any time. And for me as a child, that was terrifying. Like, I remember it in the 80s. It was always there, whether it be in the movies or in the news, it was always there. Surprisingly, a lot of people in my generation have a lot of anxiety disorders and a lot of depression and all of that. So this is just another wave of that. So that's something that rarely gets talked about. But the Barrington Initiative basically got sent out to, whether you're in healthcare or you're outside of healthcare, basically letting people know, hey, if you agree with this, sign up and read a little bit more about it. look into the data, look into the research, do your own research. Don't rely necessarily on what you get from any side of the media necessarily.
Well, I think what perpetuates that fear too is you got to put your kid in a mask. I mean, you see, even though it's everywhere that children are not a means of transmission. I mean, you go to Europe and schools are open, and we drive home from working out or whatever, and you see all the cars lined up and the moms dropping off their masked kids. And the psychological factor, like what you said, would be like when you were a kid with a threat of nuclear war. However, we couldn't see anything. So this generation is even worse because they actually have to wear something. I mean, they see it everywhere. The psychological impact, not even to mention the physiologic impact of a kid wearing masks with how sensitive kids are to oxygen deprivation and rebreathing of CO2 is even causes anxiety, not to mention living in fear.
No, absolutely. These are all things, even us, whether we're experts, psychological experts or not experts, we can guess as to how this impacts children, but we don't really know because we're not living their lives and just basing it on our own experience. It's other than the fear, your lack of social interaction. That's so important for children. I know everyone's on their phones. I know everyone's on their tablets. I know you see your kids sitting there right next to each other on their phones, like communicating with each other on text when they're in the same room. You see that, but they're still around each other. One of my good friends has kids that are young and in school, and he says, don't underestimate the impact this has on my kids not being able to see their friends and hang out with each other. They're hanging out with adults now, like all day, every day. We would have.
That's not near as much fun.
Yeah. No,
that's just not fun.
Not just fun. You just can't relate with people, right? You're
exactly.
You can't relate with anyone. So we don't even know the kind of psychological disorders or impacts this thing will have for another 10, 15 years when these kids grow up.
Well, I can tell you some stats. We anticipate at least an additional 65,000 suicides are going to occur. And we also know that previous to COVID, 2 in 10 girls were cutting themselves or doing some sort of self-harm. And also I see it. I honestly, I see this every day in my office because I work with a group called Laura's House, which are an organization for battered women. They are overwhelmed with women needing their support because this is, since COVID, this has skyrocketed. I also work with an organization called Bud's Odyssey. It's a nonprofit for vets, first responders. The amount of suicide calls that they're getting right now is through the roof. So how it's affecting children, I can only assume in a really, really negative, impactful way. And also back to the Barrington, there's been over 30,000 signatures from physicians and well over 10,000 from people in the allied healthcare. So that's 40,000 healthcare professionals agree that we are causing damage to children, agree that this is causing some what we call morbidities. What's the word I'm looking for? Collateral damage because of the lockdowns. So if we don't wake up, we're going to cause irreversible damage. So, whether the virus is out there for young people or it looks like it's less deadly than the flu for young people, not for old people, but for young people. Yet what is not, what we can take back is we can't take back abuse. We can't take back drugs and alcohol addiction and abuse, and we can't take back suicide. So my prayer is really, Amir, we got to get this right, and we got to change the course of this. And as part of what we're trying to do is resurrecting our freedom, is we're trying to get the truth out there so we can get things open up so we can, yes, protect those people, that age group that you're dealing with, but we also have to protect the younger people from the damage that this is causing.
Well, and one thing too, if you saw the presidential debate, I mean, Trump was talking about the collateral damage and he actually said the cure is worse than the cause. And then Biden's telling that he's totally irresponsible. 200,000 more people are going to die in the next 45 days. And he wants to lock down the whole country and then mandatory vaccination for everyone. So we are definitely at a pivot point, not only in the history of this country, but certainly in the history of our lives as to how this thing may go soon.
Yeah, absolutely. It's just, this virus, in a sense, is unprecedented in terms of how long it's sticking around. Let's not forget, SARS was out there at the time. SARS, I believe, had a 10% mortality. MERS, the Middle Eastern respiratory virus, had a 30% mortality. They flamed out. Okay, swine flu from 2009. The mortality wasn't necessarily as high as these viruses, but people don't remember, it was getting out there and it sort of flamed out. I believe one of Vice President Biden's assistants in November of last year said we really got lucky with that thing because it could have been really bad. Swine flu, as an example, not a lot of people know. I believe the WHO estimated 300,000 people died from swine flu in 2009 worldwide. 80% of them were under 65. Swine flu was killing young people. 240,000 out of the 300,000 were under 65 years of age. It was killing young people. And we weren't at this level of panic as we are now.
No. And isn't that really what viruses do? They come in, they spike, and then they trail off. They all do that. It's cyclical in nature. That's how the universe works, right? I mean, they come in, they mutate, they die out, just like this one. And that's where Trump said, this will pass. And, in the debate, he's like, we don't have to worry about this is going to pass. And then, so to me, it became obvious, if anybody was paying attention into the debate, people say, well, let's not make this political. Bullshit, it is political. I mean, it's exactly what it is.
In this country right now, this year, everything is political.
Exactly.
And it wasn't hard to imagine making a virus political, right? So that is going to be there, no matter how deadly this virus is or isn't, or how long it lasts. That was always going to be the issue.
Yeah.
What we need to do is, we talk about this in your office. People just need to look up the data for themselves. People need to find this information for themselves and not rely on social media, mainstream media. Go get this information yourself and you'll see what we're talking about, what most people are talking about, a lot of experts are talking about. This virus, will it ever go away? It's a coronavirus. If you look at the history of coronaviruses, they don't really ever go away. What you do is you eventually develop some kind of worldwide herd immunity to it, whether it be through overtime by just getting exposed to it, or through vaccinations. Vaccinations are a way of getting to herd immunity faster than the natural process. We talk about vaccinations all the time, and we may disagree on their utility or their safety, but that's how you get to herd immunity. It's something that, for example, influenza vaccine, it's been around for years and years and years. On average, about 50% of people refuse the influenza vaccine. So influenza, on average, for whatever reason, about half the population refuses it. Influenza is around every year. It's not going away. It'll never go away. And that's with the 50% refusal rate. Right now, we look in the news and everyone's terrified of this coronavirus vaccine. I'm not going to get it. I'm not going to get it. Right now, the polling showed about 45% of people plan on refusing the vaccine. How we got here, we can agree or disagree with, but the quickest way to get out of it for everyone's peace of mind is someone telling the population we're at herd immunity, or we're at a point where we don't have to worry about this anymore. We talk about it all the time, Dr. D. Our policymakers, whether federally or locally, they're in too deep. They've made this. They've created these lockdowns. They've inconvenienced our lives in multiple ways. It's too late. If you think about human psychology, it's really too late for them to backpedal out into, oh, this is no big deal. Right?
Otherwise, people are going to be so pissed.
Oh, it's not about pissed. It's
There'll
about
be so many lawsuits.
lawsuits.
Yeah, it's
riot,
like, oops,
protest.
I know. we're in
You
too
keep
deep,
watching.
gang. Can't stop now. We got to tell them everybody's fucked because,
you're in-
or
you're
we're
in
going to be fucked. It's either them or us.
No, no.
Is really what it's
I
come
mean,
down to.
outside of just think of human psychology. I shut down my whole state because of this. The mortality is actually under
Oops.
1%. What am I going to do? I'm going to double down. It's still dangerous. Be careful. It's spreading. The only way back from this is to tell people herd immunity is getting there, and vaccines, and get vaccinated and all that. So that's what's going to be the new push. Whether we're going to get there soon, I don't know. They keep calling it Trump's vaccine. I don't know why they're doing that. They're trying to promote people to get vaccinated and achieve herd immunity, but then they're labeling it as Trump's vaccine to sort of scare people away from it. I don't understand why they're doing it.
Well, I believe the research, what I've seen, has also said there's a 36% probability that if you get the vaccine, that you're actually going to get COVID. And of course, you know, I mean, may have different stances on this, but you know, we make videos say, okay, let's see. So you got scared, you wear a mask, you stay at home, you got fired, laid off, you do all this, you do all that, and then you're going to inject it directly into your body after all that. Then you're going to put it right into your bloodstream. So coming from a chiropractic perspective, we say don't do that. However, neuroimmunology shows the immune system and the nervous system are connected. So get under chiropractic care. Stimulate your immune system. Eat healthy. Take vitamin D. Like there's 8 million things you can do other than directly injecting SARS-CoV-2 into your body. So that's our perspective.
I'd like to add one more point to that actually as well, just a counterpoint to our discussions that we have on a regular basis.
In addition to those kind of...
I love what Fauci said. He said something that was fascinating to me. We better hurry up and come out with a vaccine before herd immunity develops.
Yeah.
So
that's because he's got one patented, right? He's in Moderna.
I just wonder, you know, at the rate, if we... Let's just talk about this real quick. If we get a vaccine for whatever, that's a limited, it's not a lifetime immunity, whereas a lot of other things, like if you get measles naturally, you have a lifetime immunity to the measles. So I understand for this issue, one vaccine isn't going to do it. They're looking at least two, and they're not even sure how long, if you get both of the doses of vaccine, because it's not a one dose vaccine, it's a 2-dose, they're questioning even how long that immunity will last for. Is that right?
Right. So, but this is where, when you hear it takes about 10 years to develop a vaccine, this is why it takes 10 years to develop a vaccine, right? You go through phase 1, 2, 3 trials to find exactly this stuff out. How long does the first injection last? What's my antibody response? When can I give the second injection, if at all? Third injection. Hepatitis B is a series of 3 injections, right? So that's why it takes 10 years to do it.
Well,
when
and
you're fast tracked like this, when you're fast tracked like this, you don't know a lot of this stuff. So guess who becomes the guinea pigs?
Yeah,
you are.
Like me, yeah.
Yeah, you are the like.
Ain't getting in line for that one. Sorry, I'm just saying.
It's going to be mandatory for people like me. It's not even going to be an option for us. It'll be mandatory. Us and the elderly infirmed are the first line of people that are supposed to get the vaccine. Right. And for us, I don't think it's mandatory. I mean, I don't think it's voluntary. It'll be mandatory. The data, we even talked about this before they started mentioning the vaccine. You know, Dr. D, I was in the office, just being a coronavirus. It's a family of many viruses that's associated with the common cold, rhinovirus, adenovirus, all of these viruses. People get multiple colds a year, right? These viruses change, these viruses mutate. So to say that you're able to get a one-time coronavirus vaccine, I don't think that was feasible even from the very beginning. So we will require multiple injections. How many, we won't know. You know, going back to your point, we're going to slightly disagree here. One of the viruses that's closest to coming out, the Moderna vaccine, is an mRNA vaccine. Basically, it's the DNA of the virus that's injected in you, and it gets your cells to produce a certain part of the virus that's not infectious, just the part of the virus that allows the immune system to recognize it as a bad guy. right? So there's different kinds of vaccinations. There's live attenuated virus, measles, MMR, chickenpox, smallpox. These are live viruses that are injected in you, and you do have a slight chance of actually getting infected from these. There's inactivated virus, the flu shot. It's the actual virus, but it's been killed off. So you're just injecting a dead virus into your body, hoping your immune system can recognize future live viruses, right? And then there's these various types of other vaccines that are biotech based, DNA technology. You're using another type of virus to piggyback this genetic code into your body in order for your body to produce these antibodies that we talk about all the time. So,
Let me stop you. How many DNA virus vaccines do we have?
God, I don't even know.
Give me a common one. Like, what's a common DNA vaccine?
Common DNA vaccine, man, they're so rare. There's not that many. Most of them are.
That was my point. There are not that many DNA vaccines, and that's what's scary because we're injecting a DNA into the system. But anyway, we got to.
That's a whole. We're gonna actually have a whole podcast. It's gonna be all about vaccination.
But we'll have to have you back, and we'll have to have one just vaccination podcast so we can. And just really quick, is Brianna getting a vaccine?
She has never gotten any kind of vaccine. I still can't talk her into getting the flu shot, so I don't think I can talk her into this one.
Love that.
That's Dr. Doug's patient, by the way.
Yeah.
That's how we.
Yeah, she. I don't.
Are you trying to make a point with that question?
Yeah.
Well, hey, listen, Amir, we really appreciate you.
Hey, man, thank you so much. Sorry.
No, it's okay.
Sorry for being so open with us. And you have a wealth of knowledge, and what you brought here, I think, was so valuable, not only for us, but for the people that were listening, to really know what's going on and to take an honest second look. So thank you for sharing your knowledge with us. I really appreciate it.
Thanks for your time, Amir.
You guys, thank
I'll
you.
see you later on the week.
Yeah, we'll see you.
Hey, it was awesome talking to Amir. And what's fascinating is to actually to be able to find out what's really going on. You know what I mean? I mean, you're a chiropractor in your office, right? I mean, we hear stories, and you're getting them firsthand in your office, the stories. But he's a pharmacist. He's dealing with the drugs. He's in nursing homes, and in the worst of the people that are affected, and to be able to find out what's going on, the medical world's impression, and to find that the medical world doesn't even agree with all this, and these are the frontline people.
Right.
That really is fascinating.
So I was optimistic about a couple things. Number one, I was optimistic that he talked about even the doctors that he works with, they're seeing the truth behind this vaccine and the virus. And so we talked a little bit about the controversy of the vaccine. So make sure, we might want to watch this a couple times and share this with a couple friends, because we go through a couple probably nitty gritty cool stuff about vaccines and the virus. The other thing I liked about it, he was talking about they're now no longer seeing the death rate in the most vulnerable places, which are these assisted living facilities, senior city and nursing homes. They're seeing the fatality rate, which used to be hundreds, like now maybe one, maybe two a month or so. So we're seeing a fatality rate drop even amongst these nursing
the worst
facilities.
people. So if that's a reflection of what's going on in the world, then why the hell does someone want to shut the country down? Why the hell are business closed? This has nothing to do with the virus, and that's what we're seeing, right?
That's exactly
in the most vulnerable population, the death rate, mortality rate is flat. Then why the hell are we doing this? So when you see that, are you asking yourself that question? Because I already asked myself that question. Well, we already know the answer. But maybe you should ask yourself and then call your governor. How about that one?
And it's not just us, although, we were ahead of this curve, I have to say.
In January.
But it's not just us, it's 40,000 other doctors and physicians and healthcare workers all signed that great Barrington report, which all agree with us that this lockdown is worse than the virus.
Yep.
By far.
There you go. Well, check it out. Ring the bell. Ding, ding, ding. Share this everywhere. Because, hey, knowledge is power, man. We got to get it out there. Knowledge is power, and stand up for our freedom, because we are resurrecting our freedoms. Thanks.